I'm Nancy Cohen, and I'm the Cancer Genetic Counselor at Northern Westchester Hospital. I hold a Master of Science degree from the Joan H. Marks Program in Human Genetics at Sarah Lawrence College, and I'm board certified by the American Board of Genetic Counseling. The reason I became a genetic counselor is it combines my interest in science and working with people. As a genetic counselor, I get to help people as they work through decisions about genetic testing and management as it relates to hereditary cancer syndromes. Patients often come to see me because they have a recent diagnosis of breast cancer and they're seeking genetic counseling and testing in order to learn information about their genetic status in order to help make decisions about their surgical choices. The hospital has made a point of making sure that patients really understand what genetic testing is about before they have it, so they have the opportunity to meet with a genetic counselor to fully understand what they might be getting involved with in terms of testing. As a genetic counselor, my science role is to translate often complex genetic information into terms that people can understand. The other hat that I wear as a genetic counselor is providing emotional support to my patients. Also, I schedule my own patients, so that allows me to speak with the patient first, learn more about their situation, and allay concerns that they might have about genetic counseling. So I see people who either themselves or family members might possibly have any type of hereditary cancer syndrome. I think the most important part about providing emotional support to patients is really listening to them so that I can make sure that I understand what their concerns are. What I love about being a cancer genetic counselor is that it really embodies the phrase, knowledge is power. When patients are found to have a hereditary cancer syndrome, there are actually steps that they can take to detect cancer early or reduce their risk of developing cancer. From a practical point of view, being focused on patients first means having spaces that we can meet with patients to provide genetic counseling that are more like a small living room rather than like a sparse clinical space. Northern Westchester Hospital puts the patient first, and that's what I really enjoy about working here.